Hello and welcome to my channel, Bevvy with Beth. My name is Beth, and in case you didn't know, this channel is all about polycystic ovary syndrome, the symptoms, how to deal with them, and how my personal journey is going with PCOS. So if that sounds like something that you would be interested in, don't forget to hit the subscribe button down below to catch my videos every single week. This week we're going to be going a little bit back to basics to start with, talking about the tests that are done in order to diagnose us with PCOS, but then also moving on, once we've been diagnosed, what tests do we need to do in order to monitor our long-term health?
Into your eyes, I see we're out of time. I guess no one's to blame, nobody crossed the line. I guess we couldn't see, somehow we couldn't feel. Maybe we rose too fast, maybe we got too high.
Before we start, I do just need to pour myself a little glass of Evian. I'm a little bit bougie and I only drink Evian now. Like I said, we're going to be going back a little bit to basics and talking about being diagnosed and what tests they do in order to discover whether we have PCOS or not. There are three main symptoms or measures that the doctors are looking for in order to diagnose us with PCOS. The first thing is normally the one that we notice, which is our irregular or completely missing menstrual cycles. Normally comes up more if we're looking to pregnant, and that's when we start to notice our cycles. But it is when you get diagnosed, you then look back and you go, yeah, I can see now how this whole time my cycle has been pretty messed up. And it can also be if you start out a good cycle and then it starts to go a bit haywire. Maybe you've taken the pill, you've come off the pill and it's been well over a year and you're still not getting back into a regular cycle, then that tends to be a sign that something isn't right, and that tends to be what leads us to go to the doctor. The first thing that they will tend to test is our androgens. So they're looking mainly for high testosterone and also the high DHEA hormone. Both of those are then indicators from our blood test that we're probably suffering with PCOS. And the final test that they will do will be an ultrasound, either externally or internally, in order to identify cysts on the ovaries. And what we're looking for is 2 out of those 3. So if we have irregular cycles and cysts on our ovaries, it's polycystic ovarian syndrome. If we have cysts on our ovaries and high testosterone, it's polycystic ovarian syndrome, and so on and so forth. And that's how they normally diagnose us. Okay, you've had those tests done, you've received the diagnosis, you have PCOS. What next? Well, before I get into the further tests to help you with your long-term health, I need to let you know that I didn't come up with this information on my own. I have, in fact, listened to some amazing podcasts by the PCOS Diva, where she talks to professionals who have worked with patients with PCOS and have helped them to get back to full health. I will link down below either the exact podcast that I listened to or just to her website. When I listened to this podcast in particular, which was with Dr Allen Hopkins, they talked about what are the best tests to do after you've received the diagnosis in order to understand how to get back to your ultimate health. The first one that obviously they raised that was very important to me was the fasting insulin test. If you go back to your doctor and ask for this specific test, that will help to give them a clear indication of whether your insulin is too high or not, and then whether insulin resistance is something you need to take care of as part of your PCOS package. The next test that they talk about, which I think is a really important one for us to be aware of because it's very hidden, and that is our thyroid. Now, I'm sure many of you, exactly the same as I myself, we've had our thyroid tested so many times because of our fatigue. And we've gone to the doctors and we've said that we're tired, and they've tested our thyroid and they said that everything's come back normal. Well, in actual fact, what we need to be getting tested is our TPO antibodies. And what these are antibodies that will, if they become too many, start attacking our thyroid and lead to hypothyroidism. If you've had your thyroid tested recently, they may even be able to check your most recent test and find out what your antibody level was, or they may wish to do a brand new test to get the most recent data on your antibody levels. But this is something that very often our doctors overlook. And so it's worth going back to your doctor, even though you've had your thyroid tested several times, and asking for that. I myself did do this, and in fact now have to have my thyroid tested every year to keep an eye on those antibody levels. So it's definitely worth doing, because they will then see those results and know that it's something that they need to monitor. I will also produce a video about how to reduce those antibodies and how best to keep your thyroid health good. Those are the tests that I recommend getting done after your PCOS diagnosis. So if you found this video a little bit helpful or even interesting, don't forget to give it a thumbs up, because it means so much to me to know that the information I am providing is helpful to you. Thank you so much for watching, and I'll see you in the next one. Or a high, no, look, I haven't got it there.